you tell us what is oral cancer?
Fungus is also called as mucormycosis. Usually, oral cancers are not seen in young individuals. Cancer can happen in any part of the body. Ayushman Bharat covers you with cancer.
Where is the treatment of cancer heading towards in future, like with AI and technology and all of it?
Okay,
What's coming up?
what is coming up? There are, if I talk about surgery for that matter, we do precision surgery. Organ preservation is another thing when it is involving vital organs. Third thing, we are also looking out for targeted therapy or
Therapies.
targeted care, or also very specific patient specific care, or basically it is you who is in the center. AI in cancer is restricted to basically diagnosis.
Okay. So how are cancers actually diagnosed, particularly the oral cancer?
Biopsy happens to be the gold standard for diagnosis.
Okay.
You have two types of biopsies which you in general take, called as incisional biopsy and excisional biopsy. Incision means if you think so the tumor is a little big or the size of the growth is big, so we take a representative chunk from the tumor which you put it up for microscopic testing, which is there, and the pathologist, whoever does it, will give you the diagnosis. That diagnosis will form as your primary source of your information for cancer. You do have imaging. Imaging will help you to guide the extent of the tumor.
Okay.
Imaging could be like a CT scan.
When you say extent, what does that mean?
Till where has it gone?
How far?
Till where it is spread?
Okay.
Till where has it come out to be?
Okay.
Has it involved vital structures? Is it close to vital structures? Has it invaded like an artery, or has it invaded a nerve, or is it invaded a vein, which would be there? How close or how proximity to a very vital structure will give you the, this will not give you a very specific diagnosis. Like for example, when you do radiographic, that is doing, so you have different modalities for that. One is you have PET. For exclusively for cancer, you have PET, or called as positron emission tomography, which you use it for diagnosis. So you use a radioactive tracer. The most commonly used is what is called as 18-FDG, called as so you have fluorodeoxyglucose, which is there. It's a radioactive tracer which you regularly use it. So that cancer molecule is in close relationship with basically glucose metabolism, which is there. So this glucose metabolism, this works in the same way to trace, and a CT scan is taken of your full body. So this lights up wherever there is a cancer cell growing up. So you see that as one of the diagnoses, but that will not give you a confirmed diagnosis. Biopsy gives you a confirmed diagnosis as to what is the type of cancer. In general, for your audience, if I have to tell, as a type of thief which has come into your body, or your own family who is there, a thief has come out from your own family which is there, which has started to attack. We need to know who is the thief. So biopsy will still form as your core basic diagnosis, which would be there. So currently there are more advances in early detection mechanisms through what is called as salivary biopsies, through fluid biopsies and other things, wherein which we can pick up tracer cancer cells at a very early stage, which is there. That will form as something a little modern, but we still prefer many times to be old school, because it is time tested and it happens to be the gold standard, which is there. So if I talk about excisional biopsy, think so there is a very small lesion inside the mouth, which is there. We excise the full thing and you send it up for a biopsy.
Okay.
So in this would be broadly classifying itself into biopsy. So we have other different types we can do and a diagnostic setup to do, like for example, you want to screen for oral cancer, we can do a thing called as brush biopsy. We use a small metal brush which was there. We can take quick samples of a person's lesion, if it would be there, to pick out diagnosis, which is there. This is called as brush biopsy.
So what is precancerous lesions of the oral cavity?
See, we are exposed to a lot of stuff.
Okay.
Our mouth is like a highway.
Okay.
In a highway, you have a tractor going in, you have a bus going in, you have a car going in, you have a bike going in, you even have some kid who is driving a tricycle inside. So you don't have a control of what is going in through your mouth, which is there. So this precancerous lesions are basically lesions which is available or which is inside the body, inside the mouth, which have tendency for cancerous change.
Okay.
So one of the most common ones is called as leukoplakia. You also have one more thing called as lichen planus. This could just be like a white patch inside the mouth which can come.
Where in the mouth?
Anywhere in the
Anywhere.
mouth.
Okay.
Anywhere in the mouth it can come.
Okay.
Sometimes it could also be not associated with any tobacco.
Oh, okay.
It could have been not associated with any tobacco. Which is there. So this is where your diagnosis will basically help you.
Okay.
Your treatment is very simple for precancerous lesion. So we might give you, it is immune modulated in many levels.
Okay.
It is your immune system kind of going in a little haywire.
Okay. Okay.
If it is very small, we give a small steroid ointment inside the mouth to be applied for a couple of months. The treatment would suffice. At the max, it is a few hundred rupees that you will spend for your whole treatment. But the thing is that if you don't take the treatment, there is a 15 to 25% chance of that becoming cancerous.
Okay.
Which is there.
Okay. Okay. What are the general modes of treatment for cancer then?
If we talk about oral cancer, and if we talk about subsides of oral cancer, which would be there of the mouth, throat, surgery will form as the first line of treatment.
Okay.
You do extensive surgery, you see something bad, you remove it together.
Okay.
So the most common type of oral cancer that we encounter on a day-to-day basis is called as squamous cell carcinoma.
Okay.
And if we go through one thing called as guidelines, which is given by what is called as NCCN, which is called as National Comprehensive Cancer Network, which is a US-based organization, which is there. They give out guidelines every quarterly, which is there, and there will be change of guidelines. So in accordance with the guidelines, so we give the treatment in accordance to it. So in early stage cancer, if I can see it, I knock it off. Okay. Let me give you a very nice patient of mine, or this was a very lucky patient of mine which I picked. This was a young lady of 35 years. She had come to me with a small ulcer, very small ulcer, very tiny ulcer on her left side of the tongue, which is there, which she doesn't know how it came. Okay. Probably she has bitten her tongue a couple of times. So I told her one thing, anyways, it is looking very small. Let me go, I will do a biopsy, I will take it out. I took it out in toto, it is called as excisional biopsy, I did. Then, when I sent it for pathological diagnosis, it came as invasive carcinoma of the tongue.
Oh God, okay.
That means to say that this particular cancer will go on to invade the deeper tissues, and it would start eating up, and it is cancer. This was, I didn't expect this at all to come from that lady. She was a very clean lady, mother of 2 children, very beautiful kids, which is there. I convinced the family that now look, she's very young. We have diagnosed it as cancer. Let us take you up for surgery. I will do a little more extensive surgery. So we took her up. I took out about 1 centimeter extra of her tongue, made a good margin. And once the margin was taken out, we treat the neck. So any cancer which would be there of the mouth and the oral cavity, or even for that matter including the thyroid which would be there, we treat the neck. In the neck we have lymph nodes. So lymph nodes are like basically what is called as our filtration mechanisms which is there in the body. These are body filters. This filter basically will filter up the bad what is called as drainage system, our bad waste which comes out through our cells. For the best matter, if somebody ends up with a throat pain, doctor who would see will first come and check the neck.
Correct. Yeah.
Oh, he will tell you have a lymph node which is enlarged. I will give you an antibiotic to basically help you with that enlarged lymph node which is there. So lymph node is the first region where it spreads. So what do? Ideally, we open up the neck either through a cut or an incision. The more modern facilities which would be there, we do it using a robot, which is there. Robotic oncology as well has been in vogue currently. You open up the neck, you clear up the levels of nodes. And this level of node, whatever you clear it, you again test it, give it for pathological testing. This is your primary preliminary school of treatment.
Okay.
Alongside with that, we give what is called as adjuvant CT and RT. Adjuvant meaning it is in alongside with the surgery. We give you chemotherapy and we give you radiotherapy. This is there.
Sorry.
The reason.
So for every kind of cancer, you have a chemo associated with it, is it?
Not always.
Not always. When is it not a part of it?
As this lady, which we diagnosed it as this particular cancer, we found out that her thing which was there, we approached her neck, we cleared her the lymph nodes which was available in the neck, and after that, by grace of God, none of the lymph nodes were positive for cancer, which is there. And as none of the lymph nodes were positive for cancer, we ended the treatment with that. And today it has been more than 3 years since the treatment has been done. She has no trace of cancer inside the body. She is living a very normal, extremely simple or beautiful life with no trace of cancer. She has been treated completely. She is healed of cancer. It's been 3 years. So chemotherapy as well is adjuvant, meaning it is not definitive. So meaning where do we come over here? Adjuvant means that you assist it. So if we talk about chemotherapy, there are risk factors that we need to take it into consideration. If the cancer is spread to the node, if the node is bigger, if the cancer has broken out from the node and has spread to some amount of tissues in surrounding with that. At that point of time, radiation again is a mainstay for cancer treatment of the oral cavity and oral and throat, which is there. The reason behind radiation is that now the general surgery will treat what is called as gross disease. What I see, I take it out.
Okay.
What about the microscopic spread? The cell to cell, I cannot see that. That is where radiotherapy is given. So you mark out a region. Like for example, let us take a best example. Let us take a case of mine which can be as an example, which is there. A lady who is 39 or 40 years old, was a patient who came to me, who had a history of basically a broken tooth in her mouth. And repeatedly for a couple of months, the broken tooth was there, basically rubbing her tongue, causing a wound on the tongue. It so happened that the tongue lesion turned out to be a cancer. It never healed. She should have basically come to us a little earlier, a few months ago. A 500 rupees tooth extraction would have been more sufficient enough for her treatment. But she missed that bus at that point of time and she landed up with cancer. This lady who had cancer, we operated her extensively owing to her age, which is there. When cancer comes to young people, it comes vigorously. It is very aggressive.
Okay. Okay.
Compared to older. Younger patients suffer more, their life gets truncated because of cancer. So, when this is what you are questioning, you need to do more extensive surgery. So, we gave her extensively, we dissected up from her tongue. We took about 1/3 to half of her tongue out. We approached the neck, which is there. As she was a very young lady, we used a tissue from her hand called as radial forearm free flap. We put the tissue up in the tongue, so whatever where the tongue was removed, this was replaced it with a tongue, kind of a tongue tissue from the hand, and we stitched it up. And the blood vessel which came from the hand was stitched to a blood vessel in the neck. After that, we got to know that she had node positive in the neck.
Okay.
Her node was involved at that point of time. Now there is availability of more modern treatments for cancerous. This is one of the things. So we get what is called as in case diagnosis we get. Meaning I can diagnose a particular patient as the patient is getting operated.
Oh, okay.
As the patient is getting operated. So we have facilities in major hospitals right now called as frozen section. This frozen section diagnosis, what it does is that you can take sections of the tissue. You freeze it and you take a section. Now, this will help us to quickly, like for example, now I told about this lady who had a lesion on the tongue. We excised it. I wanted to see how much is the margin that we have given with the healthy tissue.
Okay.
The basic preliminary cancer, we need to give a margin. Margin means if I have a 1 centimeter of a cancer which is growing, I need to cut out 2 centimeters, where 1 centimeter is a healthy tissue margin, where the cancer might have spread. This is what is called as a margin. So this frozen section diagnosis helped us with basically the neck lump as well, which was cancerous. After that, she received 35 sessions of radiation, which is there. So 35 sessions of radiation. Alongside with that, she received what is called as radiosensitizing dose of chemotherapy.
Okay.
Which is there. It has been more than 2 years. She has recovered very well. She has very much gone back to her work. She is working. She is living with us as a normal commoner, which would be there. But she is under a surveillance. So this is where post cancer, when it comes back, we need to survey. Basically, you have to be put on a radar. This is where the follow-ups come.
Okay.
Which is there.
Okay. So, you mentioned that surgeries are the most extensively used mode of treatment in case of oral cancer, right? That would involve post-surgical treatments, right? Is it easy for the person to talk, eat, swallow,
So,
all of that?
yes, it is a very easy and a difficult question to answer.
Okay.
Easy because uh, we resect, we take it out, we need to rehabilitate them. So this is the easy part to just tell. But yes, so face is disfiguring. We might know the most popular figure in India who has suffered from oral cancer is Sharad Pawar, the NCP party head. He had oral cancer. If you might zoom into his photo, his mouth has become of the size of a small, tiny opening has come out right now. He was a patient of oral cancer. So it is disfiguring for a person's face. There will be a gross change of the face, whatever would be there. We are not gods to create faces. We are in fact just humans. We can replicate God. We can see that, oh, God has created it so beautifully. I can come to it, wherein which I can come and touch about 70% or 80% of it. which is there. Even the best plastic surgeons would match that. So disfigurement of the face is one of the problems. The second thing, the patient would have speech swallowing issues which would be there. To address that, we have what is called as SLPs is there. Speech and language pathologists are there. These are trained individuals who work alongside with us. Your rehabilitation starts in very early. You start making them swallow food very fast. You start making them swallow water very fast. You start making them eat food. This in the rehabilitative journey, this is a part of the rehabilitative journey that you go through. Which is there.
How do your patients actually react to disfiguring of face or very simple processes like speech? If there's a problem, right? How do they first react to it? Or how do you handle patients when you tell them that this is what is going to happen?
At one point of time, you need to be blatantly truthful to them. But that would also mean to see that how is their mental health and mental status at that point of time. We can't always be rude to them. We can't always be completely truthful to them. You always give a shield of cushioning to them. And you need to break the news open. This is for a betterment of the patient. This is for the betterment of his own life. He gets a second chance of his life. So the second chance of his life comes through basically him taking the treatment, which is there. But this also can come to acceptance levels. He needs to accept that now, yeah, I have this problem. I need to live with this problem. I can't let go of it. It could also be this problem was created by me at some point of time because of my habits. And this habit has caused me this problem. Now I have taken treatment, I will do well. And the third thing is that when we see patients which would be there, depression is also one of the main problems which we see it in cancer patients. Because cancer patients go through a very long treatment, long treatment. It will go on for 3 months, 2 months, 6 months, 8 months treatment is going on. They will not see the end of the tunnel. They would see a light at the end of the tunnel, but they would not see the tunnel. They will not be able to come out of the tunnel. They'll be still in the tunnel, which is there. It can be really stressful at that point of time for the patient. So how do you, a lot of comfort you have to give it to the patient. How do you give comfort to the patient? One, speak to them. Use, you have a specialty of psychologists called as psycho-oncologists who are there. These are specialty oncologists, oncopsychologists who are there, who take care of care with respect to cancer. Because a normal person receiving psychological care is very different from an onco patient receiving psychological care. Because normal person will not be receiving any treatment. He might be depressed about many things else. Now this patient is depressed about the treatment. Depressed, the treatment is never ending. So the onco specialty psychologist or a psycho-oncologist come in when you feel as a doctor, when you feel as a treating physician or a treating surgeon who would be there, you need to look out for signs and symbols of depression very early on and take a support of your colleagues from as a psychiatrist or a psycho-oncologist. You refer it to them, ask them to look into it, ask them to speak to the patient, ask them to see what is going wrong, give them therapeutic help which would be there as a part of behavior therapy and other things, so that they are kept in good spirits.
Okay. Does mental health of the patient play a role in the prognosis?
Partially, not completely.
Not really.
Partially, agreeing to the owing of the stress which is a factor which is involved. Mental health takes sometimes as a back seat when you are giving treatment. The reason is that you're going on full blown. You're going on in the most aggressive mode possible. The mental agony comes because of the patient's face. Radiation burns up tissues. their mouth is dry, their mouth is full of ulcers where they cannot eat or drink water, and it becomes very painful for them. That agony, you take it out, cancer might not recur because of that. But the thing is that you need to keep them up in good spirits. Basically, motivate them that yes, you are going through this treatment, you will finish the treatment soon. Which is there. That is what you need to keep on reassuring them until the treatment gets completed.
Okay. Is cancer contagious?
No.
None of the type of cancers are.
No.
So it doesn't matter.
HPV is contagious.
Okay.
Human papilloma virus is a very contagious one. Human papilloma virus sometimes can cause cancers. It can cause
so
anywhere.
once diagnosed with cancer, it doesn't mean it is contagious, right? So
it is never contagious.
So you
It's
don't
your
have
own.
to really worry
It's a civil
about
war. It is very much
being with the person and being next to the person and all of that. So to wrap this up, if you have one life-saving tip that you would want to give everyone who is under the risk of probably cancer, what would that be?
visit a doctor soon.
How often?
You don't need to visit them often.
Okay.
If something is looking a little wrong, if I have to tell it very specifically to my subspecialty of oral cancer, which would be there, you might have some irritation coming up through your mouth, as in a part of like an ulcer, or something like a white patch has come inside your mouth, or something might be wrong when you're finding it a little difficult to swallow some type of food. Visit a doctor soon. He might just give you a medicine. That white patch could as well turn out to be a small fungal infection which can happen inside the mouth, where the cure is very simple, like one ointment which the doctor might give, which would be there. Or an ulcer could be just a simple traumatic ulcer where the doctor can pull out that tooth and make you free of the problem, because that would be the causative factor. Or it could just be another infection,
Okay.
which is there.
Okay.
Not everything that comes is cancer, which you diagnose. But at some point of time, you need to decipher the fact that do not delay.
Okay.
Come in early. You can get, if there is history of oral cancer which would be there in the family, get yourself regularly examined by a dentist.
Okay.
Once in a while, you get yourself regularly examined by a dentist if there is any ulcer or anything which would be happening. Or if you're prone to having a lot of ulcers coming in from the mouth, regularly come to a dentist. Ask him to just see regularly. This can prevent you from getting cancer as well. And if picked up early, your treatment happens early, you will go cancer free very fast.
Okay. Thank you for that immense amount of information.
Thank you.
So moving on to a different segment of your area, right? Other than oncology, what else do you deal with?
So I deal with what is called as complete oral rehabilitation of a patient, wherein which we give teeth to people basically who have no teeth inside their mouth.
Okay.
So we replace it with what is called as implants. We do what is called as dental implants, which is there. As maxillofacial surgeons, we are specialty or specialized in giving them the highest quality of implant care, which is there. So currently we have technology available in India, which is the world's most cutting edge. The most modern technology which is available in India is available in the world is available in India, which is there. You have the best implant systems, which is there. We have the best labs, which is available in India to give them rehabilitation. So this time has gone forward from where you had to struggle with dentures to come up with fixed teeth in a few weeks to few months should be there. So this is called as endosteal implants.
Okay.
And over the past 30 years or 40 years is when the implants have started. The success rate of implants when given for a right candidate is around 98% success.
Wow. Okay.
So you can achieve close to, which is 100% of success rate is available for implants. Once implants get stuck and you maintain it as a simple maintenance process for basically brushing your teeth 2 times daily and do a mouthwash daily, your implants will survive with you throughout your life. Even after 30 years of evidence of, if we see with implants getting placed, around 94% of implants have survived. Which is there.
Okay.
So
yeah, to make things clear, when you say dental implant, it's what you mean is when your permanent tooth is gone.
yes,
You refill that, right?
you
Uh,
not refill
replace.
it, replace it.
Replace
Very
it
much
with
replace it.
a tooth.
Replace it with an implant. Implant will act like a tooth. It
Like
is not a tooth. It is like a tooth.
Okay. So the cases that come to you for dental implants, I'm sure would involve certain amount of trauma, right?
No,
Not always.
not always.
So what? So where does trauma come into this?
Trauma is where they end up with road traffic accidents.
Okay. Okay.
When basically not wearing helmets.
Hmm.
It is one of the most common trauma that we encounter is facial trauma.
So why does someone come for a dental implant?
3 reasons.
Okay.
You have a decayed tooth.
Mm-hmm.
The decay has gone to such a level, basically it is unrestorable, which cannot be restored with root canal, it cannot be restored with a cap. At that point of time, we pull the tooth out right there. In where that same tooth was there, we will replace the same place with an implant.
Okay.
And that implant is fixed. In about 2 months' time, the implant heals very well and we replace it with a cap.
Okay.
That will give you a 1:1 replacement for the teeth. And once you rehabilitate them, they'll be able to eat the same way they were able to eat before with the same tooth.
Okay.
Which is there. This is one of the reasons. The second reason what it causes is that because of poor oral hygiene. If you're having a very poor oral hygiene, this causes basically from what is called as recession of the gums happen. There would be recession of the bone happening because of infection which is persistent for over a couple of years, which is called as chronic periodontitis, which is basically infection of and inflammation of the gum tissue, causing your teeth to just shake and fall out. As the teeth shakes and falls out, you replace it with an implant.
Okay.
That implant again is permanent,
Okay.
which would be there. So this would be the most common 2 causes of patients coming to you for, or patients coming to me for implants, which would be there. Third, we replace the implants sometimes with a missing tooth due to childhood. When a child might have missed or broken a tooth when he's playing in the childhood, and when he comes to adulthood, we would like to replace it. Okay. Which would be there. This would be the 3 most common set of people that we approach with. People want implants for.
Okay. Okay. So what are the various stages of implants?
Implants can be done in terms what is called as a single stage implant or a 2-stage implant, which is there. A single stage implant is basically wherein which on the same day we place the implant, a day or 2 later we will be able to give you a simple prosthesis, and where the person would at least be able to gently bite on that.
Okay.
If the bone conditions are favorable. That is called as single sitting implant, which is there. But in most technicality, if we want to give them to bite for the backside teeth and other things, which would be there, where we replace it for basically chewing and grinding, implant happens in 2 stages. The first is what is called as a surgical stage, and the second thing is what is called as the prosthetic stage. In the surgical stage, we open up the jawbone, which would be there. We will see the measurement of the size of whatever the implant which is required. We sink it into the bone and we leave it for around 2 to 3 months and up to 6 months period of time for that implant to completely heal.
Okay.
As the implant heals, which would be there, we will go ahead with the second stage of the implants. What is the second stage of the implant? The second stage of the implant is wherein which that same sunken implant would have grown bone around it it would have become a part of your body, what is called as osseointegration. Integration. So if you go into what is called as integration, you integrate it. So you integrate, like for example, a process is integrated into the company, meaning this becomes a part of your system. So this bone gets formed around it as it gets integrated into your body, which is called as osseointegrated implant. Once it is osseointegrated, this implant would have been ready to take the second stage. We explore that implant, and once we explore that implant, we go in for what is called as the prosthetic phase. Processes is basically, if I can tell you, you have a house which would be there. A foundation is that actual implant that you place inside. Over the top of it, whatever you build a superstructure over it, like you can build a commercial building over it, or you can build a thing over it. So this could well be an upper structure, whatever you build is the prosthetic phase. So you have different types of attachments which come through that, and different types. It could be where the location which it comes. If you need a very aesthetic region, we have aesthetic ones, like the front teeth, if you would like, that comes for more show. If it is for more function which would be there, we can give components very specifically for function. And that is very well catered to that specific patient, which would be there. That is which comes in the prosthetic phase. And prosthetic phase, we will rehabilitate the patient so that he can have foot like how he is having it before, had it before a few years or 10 or 15 years back, which is there.
Over time, does this cause, does the implanted tooth, does it cause infections and all that?
Yes,
Like how a
peri-implant.
dental tooth
So
would do?
peri-implant still behaves like a teeth.
Okay.
Like how we discussed a few minutes back about periodontitis, peri-implantitis as well is noted.
Okay.
What happens with the implant is that once the bone grows, if you have very bad oral hygiene that you maintain, at some point of time, implants can as well get infected with the same bacteria. Our mouth has more than a couple of thousands of bacteria, which is there. Our mouth is a bacterial warehouse, which is there. Understand that this is what is called as oral microflora. Many bacteria are very useful for our digestion and useful for our body. These are called symbiotic bacteria. Some harmful pathogenic bacteria are also present in the body, where our immune system would have kept it in a suppressed state or a controlled state, which would be there. And this implant, sometimes if it gets infected because of bad oral hygiene, it can cause the implant to fail. It is what is called as peri-implantitis, which is there. It is noted, which would be there. The treatment for that, either you remove that implant or you clean the implant with lasers, which would be there, and you rehabilitate them with bone graft and other things, so that if you want to salvage that implant, that was well, which would be the treatment which comes for this.
Okay.